What is the main aim of today's launch?
The main aim of the framework for climate services is to work across different sectors and to see how is it that by having better information on climate service, on weather, for example, and what it's expected to arrive, that we can all prepare and respond better. So I'll give you an example of why is it that we're covering that and being part of that as part of the health sector. I work for WHO, for the World Health Organization. We feel that there's great mileage in getting better health through participating, to being included and contributing to this framework for climate services. I'll give you one example. In the 2003 heat wave that happened in Europe, there was an excess of 70,000 deaths. People learn from that experience, and in France, for example, they have identified what were the risks, what was causing more people to die, which was mostly the elderly, living in poorly insulated homes, isolated, plus the heat. Next time round in 2006, when there was another heat wave, the French were better prepared. And there's actually some analysis that show that instead of the 6,000 additional deaths expected, they only had 2,000. And that was because there was better knowledge about the heat wave was coming up. People could prepare, the health systems could be prepared, individuals could be prepared. So, and also people who were exposed to certain risks like air pollution. You know that air pollution interacts very closely with hot weather, and it causes many more deaths by having the two at the same time, high air pollution and heat waves. So by preparing better, by knowing, which is what actually the framework for climate services is about, is better warning, we can protect people from those risks.
Is it the case that much of that information is already out there, but it's isolated, it's gathered unilaterally, and is it really just a case of making sure the information is spread right across the board, right around the globe? It's
a lot about building connections between the information in different silos. We in health are very rich in information. There's lots of stuff there. But we haven't perhaps connected as much with the weather information or with the food production information or with even the air pollution that we do have. We haven't perhaps made those connections. So what the framework is helpful is in actually bridging those gaps. And what we're seeing as a result is more cost-effective interventions from the point of view of public health. We can measure that in public health. We know that that also means savings for individuals, for businesses, better planning for the health sector. So there's a lot of advantages in building those bridges across sectors.
I can see that the theory makes sense, but I wonder in practice, information gleaned, say, from the experience in France, how is that transferred to somewhere, say, Burkina Faso, relevant information? How does it actually reach the people who might need that information there?
Well, that's one of the reasons why health is part of this network, because we do have in the health sector, there's lots of information on disease and mortality in many countries, in many small communities. So the health sector is very rich in that capacity. So by building that grounded information, what's happening on the field, with information from meteorology, for example, which are estimates from satellites, that you can, by making that link, we can link what's happening in the ground, what is the weather, for example, happening, and the information that WMO or others would have from satellites. So there's one of the reasons for the partnership and why it makes sense to make those connections.
And is there any kind of time frame being talked about at the moment when you would like to see this framework implemented?
Well, the framework is already being pushed in a big way, and there's this plan which is being developed. So many countries are already implementing parts of the framework. So I think we're seeing this being implemented in action. Some people in the audience has raised that some countries are not yet there. And my own personal view is that they haven't yet seen or looked into the cost of inaction. Because if you do look at the cost of inaction, you see that it makes sense both for businesses in terms of reducing risk for businesses, but also individuals and government.
Yeah. We did hear that in the debate from several points of view. It's far more costly not to act, not to invest, than to actually invest.
That's correct. And in health we have we can monetize those impacts. So it's one of the other uses that we have for the health information, that we end up quantify what are the benefits from adopting the framework for action and building some more connections on the existing information, improving that system, and versus not doing so.